Hey YouTubers, um, it's Joe again. So today we're on Chapter 4, Legal Responsibilities for ATI Fundamentals. Questions 1 through 5 and answers. Okay, so let's just go ahead and get at it. Question 1. A nurse observes an assistant personnel reprimanding a client for not using the urinal properly. The AP tells him she will put a diaper on him if he does not use the urinal more carefully next time. Which of the following torts is the AP committing? Assault, A, B, battery, C, false imprisonment, or D, invasion? The answer to that question is A. By threatening the client, the assisted personnel is committing assault. Her threats could make the client become fearful and apprehensive. Question 2. An adult client who is competent tells the nurse that he is thinking about leaving the hospital against medical advice. The nurse believes that this is not the client's best interest, so she administers a PRN sedative medication the client has not requested along with his usual medication. Which of the following types of tort has the nurse committed? A. Assault, B. False imprisonment, C. Negligence, or D. Breach of confidentiality? The answer to question 2 is B. The nurse gave the medication as a chemical restraint to keep the client from leaving the facility against medical advice. This is false imprisonment, and because the client neither requested it nor consented to receiving the sedative. Question 3. A client who will undergo neurosurgery the following weeks tells the nurse in the surgeon's office that he will prepare his advance directives before he goes to the hospital. Which of the following statements by the client indicates to the nurse that he understands advance directives? A. I'd rather have my brother make decisions for me, but I know it has to be my wife. B. I know they won't go ahead with the surgery unless I prepare these forms. C. I plan to write that I don't want them to keep me on breathing machine. D. I will get my regular doctor to approve my plan before I hand it in at the hospital. The answer to that question is C. The client has the right to decide and specify which medical procedures he wants when a life-threatening situation arises. Question 4. A client is about to undergo an elective surgical procedure. Which of the following actions are appropriate for the nurse who is providing preoperative care regarding informed consent? Select all that apply. A. Make sure the surgeon obtained the client's consent. B. Witness the client's signature on the consent form. C. Explain the risks and benefits of the procedure. D. Describe the consequences of choosing not to have surgery. Or E. Tell the client about alternatives to having the surgery. The answer to question 4 is A, B, and that's it. So A is it's the nurse's responsibility to verify the surgeon obtained the client's consent, that he understands the information the surgeon gave him. B is correct because it is the nurse's responsibility to witness the client's signing of the consent form and to verify that he's consenting voluntarily and appears to be competent to do so. The nurse also should verify that he understands the information the surgeon gave him. Alright, that's question 5. A nurse has noticed several occasions in the past week when another nurse on the unit seemed drowsy and unable to focus on the issue at hand. Today she found the nurse asleep in the chair in the break room when she was not on a break. Which of the following actions should the nurse take? A. Remind the nurse that the safe client care is priority on the unit. B. Ask the others on the team whether they have observed the same behavior. C. Report her observations to the nurse manager on the unit. Or D. Conclude that her coworker's fatigue is not her problem to solve. The answer to 5 is C. Any nurse who notices behavior that could jeopardize client care or indicate a substance use disorder has a duty to report the situation immediately to the nurse manager. And that's it for Chapter 4, Legal Responsibilities, ATI Fundamentals.